Steve Dotto here. How the heck you doing this fine day? And a great big welcome to you all for Webinar Wednesday. We're halfway through April already. Holy cow.
I know. No, it's like tax day tomorrow. Extended tax day.
Spring has sprung and COVID shots are going into people's arms left, right, and center.
Yes.
How are you feeling today? April had her second shot. When did you have it? Monday?
Whoops, so sorry. What's
going on?
There we go. Oh, my volume, when I was playing it on YouTube, it started to turn on there. Sorry.
When did you have your second shot? You had it on Monday?
I had it Monday. Yeah, last night I actually had a fever. I had a fever and I had the chills, but I woke up today and I feel much better. A little foggy, but I feel better. A little bit of a dull headache, but good. I'm good.
Well, I had mine on Monday as well, the first one. And yeah, a little rocky, but
yeah,
but not bad. Not bad. Just starting the process. It's a long way to go yet. So everybody it's perfect timing that we're talking about health, because today's topic is and online health, because everything has changed. You know, we could talk about this new normal, and not everything is bad in what we've learned. I mean, I think that we've learned how to work from home so much more effectively, and although that causes some new issues, it does reduce the amount of time we spend on the roads. Although most cities are, I think, kind of getting back to the kind of heavy traffic situation they were in before. But, you know, people now recognize that they have the option. We're seeing a lot of people migrating out of the big city and moving into smaller towns. Lots of things have changed, but has anything changed more than a visit to the doctor? I don't know.
Yeah, that's true. I actually was at the doctor yesterday, and it was a different experience for sure.
And you went in. You went in.
I went in for this appointment. Yep.
Yeah, and I bet you the waiting room was nearly empty.
It was. It actually. I didn't have to wait in my car. They must time it because there was no one in the waiting room. And when I left, there was one person there, and they had me wait, and they brought them in, and like the traffic cops.
It's going to be a typical webinar Wednesday. I pre-recorded the demo. We got a fantastic interview with Dr. Ali Rosen, who does clinical work both online and of course in person. And she's going to talk to us about best practices, things that we can do ourselves to kind of empower ourselves a little bit more as we navigate this new place. But after I'd recorded the demo already today, I was listening to another podcast, and completely out of the blue, they started talking about healthcare, online healthcare, and they floated a really fascinating statistic. Pre-pandemic, the amount of telemedicine calls, the percentage of medical calls that were telemedicine, which is kind of what we classify all of these online calls. Pre-pandemic, the percentage was 0.8%. Less than 1% of all medical appointments were telemedicine. Now, as we come out of the first full year of the pandemic, 30% of medical appointments are online. 30%.
Well, it's funny you say that, because my insurance provider actually keeps sending. I actually got a telehealth card to be able to use as part of my insurance, so I can call in. Like if they give you a list of symptoms that are covered, so you like call and have a telemed doctor instead of in person.
But you're not going into your clinic. You might be getting any doctor. So there's some different things that we have to consider if we're going to be using especially a generic telemedicine service, as opposed it's very different if you have a one-on-one consultation with your doctor who has all of your records versus a telemedicine call to a general service who doesn't know you from Adam, right? So those are those are some of the things that we're going to be going through. So let's get a few details out of the way, and then let's get into the video today and get started. So typically speaking, on Webinar Wednesday, we pre-record the demonstration so that we increase the information density, and we've done that today. The video today is just under 30 minutes as I go through, and we talk to Ali, and I also am going to demo some health, some wearable health care items. I'm going to show you how blood pressure, a Bluetooth blood pressure monitor works, and walk you through some of that, and have a good conversation about the wearables as well, about the watches. But before we begin all of that, we have to do a great big shout out to the people that keep us going, which is our patrons. Dottotech is a community-funded channel. We're supported through the generosity of our patrons. If you are interested in supporting Dottotech, you can drop by patreon.com/Dottotech, and there you can learn about what being a patron is. We deliver these free tutorials each and every week. This is number 168 of these webinars that we deliver each week, and we do that. For the general good. But a lot of people feel that there's tremendous value in that, so they financially support us to make sure that we can continue to deliver this product. And we have a great quid pro quo. There's perks that are involved. If you sign up as a $10 a month patron, you get access to all of the Webinar Wednesday archives. Each week, we deliver one of these webinars, and it stays up online for a week so people can view it for free. After that, we archive it with 167 other webinars, and our patrons can go through and they can grab any of those webinars and any of those tutorials, and they can bone up on their skills at any time in the future. So we have to say to them, thank you so much. I know there's a lot of you commenting already in the comments, so we would not be here without you. And we also would not be here on air right now without our other sponsor, which is Restream.io. We are coming to you from the Restream studios. It sounds like from Burbank, California. But Restream is a streaming service that allows you to multicast and to deliver live streams to multiple platforms at the same time. So we're live on Facebook right now, and we're live on YouTube as well. And a part of that package of tools that Restream gives is a interface, a switcher app, which is basically a studio app that April and I are in right now that allows me to do things like run the videos, add credits, lay over, bring up people's comments, bring in guests. All of that is done through Restream.io. So if you're interested in doing live streaming the way Steve does live streaming, drop by and take a look at our link for Restream, and you too can start broadcasting to multiple platforms at the same time. All right. What else have we got to cover then, April? We good?
I think you did well. You did good. You got it covered. Okay. I think we're good.
All right. Let's jump into the video. We have a special guest in the video, which is Ali Rosen. In full disclosure, there is a familial relationship. Ali is my son's partner, but she did a great job of kind of answering a lot of my questions and kind of opening our eyes to, because all of our online medicine isn't quite equal. So Ali will illuminate us. So we will see you on the other side of the video. April and I will be in chat answering as many of your questions. We will answer the rest of your questions when we come back. So let's get to the video. My cat is walking around behind my desk, going past my video gear, purring like a madman. Oh, there she's out. Okay. E-health and online health, telemedicine. We're going to be talking about all of those topics today here on Webinar Wednesday. And a lot of the genesis of this webinar has really come as a result of us starting to recognize this new normal that we are all experiencing as a result of the pandemic. So many things have changed for us. So the way we do a lot of things have changed. And one of the things that has changed the most is a visit to the doctor. Whereas we used to go and sit in a waiting room and wait to see the doctor, now we often have an online appointment, a telemedicine appointment, video conferencing of some sort, and it has really changed things up. And kind of at the same time as that, and maybe because of that, we're becoming increasingly aware of all the different gizmos and gadgets that we can have that measure different aspects of our health. I mean, first and foremost is the wearables, the watches. So I thought we would cover that today. Now, today on we're not going to cover, I kind of want to make sure that we're all on the same page. This isn't about fitness. This isn't about nutrition. There's lots of apps and there's lots of things we could talk about in that space, but that's for another webinar. We're going to focus on wearable and online tech, health, and telemedicine. And we've got a great interview with a good doctor that's going to give us some great advice on things that we can do to make our meetings, our appointments with our doctors, that much more efficient. And we're going to take a look at some of the different wearable and connectable devices. So shall we dive right in? So as I say, we've got this new normal now where we're now, and I think for all time moving ahead, we've changed a lot of the way we do things, and nothing really more than medicine, than going to the doctor's visit. And there's a lot of positives to it, but there's also a lot of things that it's not quite as good as the old way of doing things. And we don't often say that. Usually we think the new way of doing things is always going to be better, but not always is the case. So let's start things off with a visit to the good doctor. Now, this particular doctor, I have full disclosure, I have a family relationship with. Allie is my son's partner, and I love her. She and Luke live in Toronto, and she is a GP in Toronto. But she does a lot of telemedicine. In fact, she has kind of a side hustle going, which she works for one of the national online healthcare providers, one of the national telemedicine providers, as well. She has her own clinical practice. So I asked Allie if she would spend some time with us and talk about what it's like, what telemedicine is like from the doctor's perspective, and maybe give us some good insight into things that we can do to have a better relationship, to make things easier for our doctor and things better for us, to have more clarity of information going back and forth to improve the quality of healthcare that we all experience. Graduate from medical school?
I graduated med school about 5 years ago, residency 3 years ago.
Now, did they have any idea that you would be treating people virtually when you were in school?
Absolutely not. We didn't get taught about it. It wasn't referenced. It was assumed that so much of treating patients is the physical exam and seeing them in person.
So do you think there's a bias against it, that most doctors feel that it is kind of a second-rate service?
That's an interesting question, because previously maybe people would have thought that it was more negative, less accurate, more prone to error. But I think the more that we are working with this telemedicine space, the more we're learning that it has a lot of benefits, and there definitely is a space for it, not only now in COVID times, but beyond as well.
Now, you're a GP, you have a family practice, a regular practice as well. You do, what would you call the practice that you do for the virtual service?
For the virtual service, it's more like a drop-in clinic. These aren't patients that I see more than once. These are people from all over the province who either don't have a doctor or can't see their doctor in time, evenings, weekends, and they just need to see someone quickly and get something dealt with right away.
It's replaced the drop-in clinic for I've got a sore throat or I sprained my ankle.
This is the new drop-in clinic, and we're seeing a lot of sore throats, yes.
Now, do you notice a big difference in the engagement you have between your regular patients online and the drop-in patients?
Honestly, both of them have been packed. The online drop-in is consistently very busy. Back a year ago, not so much, but it's consistently fully booked every single day. And patients in my personal practice too have really taken to it and book just as many appointments in person as they do virtually.
I love not being in the waiting room with other sick people. And I love the fact that my doctor's, I don't know if you're always a little bit behind, but when he's behind, at least I'm home doing stuff before the call comes in.
That's exactly it. I have a lot less guilt leaving people waiting because I know that they're at home, or if you're taking time off of work to do this appointment, you can be still working, still doing your thing, and really only take 15 minutes out of your schedule versus having to take a whole day off to travel and wait and then see your doctor.
Do you think that the patients are becoming more collaborative with their doctors because we're doing so much ourselves?
I think you are right in that. And I would think about that as twofold. First of all, in terms of equipment at home, like a smartwatch or a Fitbit or the blood pressure cuff, there's access to linking that now to your doctor's office, emailing them a printout, sending them these numbers that we never really could do before. Patients with diabetes can just upload their blood sugar recordings to the internet and their doctor can see it. So that does involve a lot more patient engagement, but also now being virtual, the onus can be a lot more on the patient in terms of describing what your symptoms are and showing me what the rash is, because I can't listen to your heart. I can't, lay hands. This is all done through this digital interface. So I'm getting a lot more patients who are emailing photos of rashes and who are.
I was just going to ask you. So, that's like, I've got this mole. Sending a picture, is that as good as being able to just kind of reach out and scrape on it with your fingernail yourself?
It depends on the quality of the photographer. There's a lot of out of focus images, and you can barely tell what kind of body part you're looking at. But when it is good, it can really save you a lot of time, because if something needs to be sent to the dermatologist, I can do that in 5 minutes versus waiting for you to come in, seeing in person, and then sending you off. It can potentially skip time-consuming steps.
So the first tip that we can share with our community is quality of information is really important. So if you've got a mole, get somebody else to take the picture of it and make sure it's in focus before you send it to the doctor. But then it becomes a great asset to help us work our way through this situation.
Absolutely. If there's quality information being shared, we're able to access it just like we would access the information if we're seeking it on our own in an exam with you. So you can help bridge that gap.
That's one of the things that's kind of frustrated me as I started to do the research on it, Ali, was I've got, like, I use an Apple Watch and I've got the Apple Health Kit, and there's some phenomenal information in there. It gathers all my blood pressure information. It gathers my heartbeat. It gathers, it ties into my, my Bluetooth scales for my weight and all of those things. But there doesn't seem to be a universal and easy way for me to just share that information with my doctor. You guys need to have a special app. Is that something that you see growing, or is it always going to be a bit of a barrier, that privacy issue?
I would love to say that I see it happening, but unfortunately, the state of medical electronic records right now, especially in Canada, every clinic works with their own company to have their own medical records, and they don't even communicate well with each other, clinic to clinic, hospital to other hospital, let alone patients' individual devices being sent over. So I wish that were the case, but I'm getting a lot of PDFs, and you just have to work with the information you have.
So if you're lucky enough to work with a healthcare provider that provides the app, that's great. It makes it easy. But if not, we have to MacGyver. We have to figure out our own way to get the information out of our own record system and share it with a doctor. And Apple doesn't necessarily make it easy, but usually the other apps, the diabetes ones, I imagine, make it a lot easier and those sorts of things, right?
Yeah, a colleague of mine works exclusively in a diabetes clinic, and they have a set app that's integrated with their record system. So every patient uses it. Every patient is trained how to use it. And that's fantastic. That empowers a lot of patients to look at the trends in their blood sugar and see how they're doing. But we just don't have that right now in primary care, broadly speaking.
So walk me through best practices for a patient like your most awesomeness patients that you have that are prepared for the calls. What do you look for in a call when somebody's calling in, of somebody that really is taking control of this process?
I think firstly, feeling comfortable talking to your doctor over the phone or over video versus face-to-face, recognizing that this is still a medical appointment. We can still get things done, even though it's a less typical interface than you're used to. Automatically open
the door. We often don't see Scandy, your dog, in the background when we come to the clinic.
No, and I find she makes people a lot more comfortable seeing her run back and forth. But so being comfortable with the setup overall is a great step. Also, coming prepared. I am a list maker. I'm a fan of lists. I encourage my patients in any appointment to have a list of questions and things they want to go over, just so we can make sure that the appointment goes smoothly and nothing gets missed. And also being prepared, having your medications with you is a great idea.
Yeah, just having them there.
People used to bring them in a plastic bag. If I'm seeing you in person, that's fantastic. But if you're at home, you can run to the bathroom and get your medicine out of the medication cupboard, and we can confirm exactly what you're taking. That is incredibly valuable.
Yeah, especially for those drop-in type appointments, not when it's with your because when it's a drop-in appointment, do you have access to all of those patients' medical records, or are you relying on their verbal history that they're sharing with you?
We don't have access to anything. We're essentially going in blind. I don't know what you've had done in the past, surgeries, medications. It's a blank slate as far as what I see when I'm talking to you. So being able to fill in that information quickly and efficiently while also making sure you have time to discuss the issue at hand is a bit of an art that we both try to do, patient and doctor, as well as possible.
Now, hat in hand with the fact that we're now visiting you online and we're doing more of this stuff ourselves, we also now have access to WebMD and all of these other services that we can look. And so we can now, do you appreciate if we've done a little bit of research in advance and I say to you, you know what, I think I might have a hiatus hernia because of this that I've looked up, or would you rather just go through the discovery process yourself?
So if you're able to look up all your symptoms and figure out exactly what you have, and I confirm it, good for you. That's really great. And you did the work and you figured it out. But at the end of the day, you're coming to see me because it's my job to figure out exactly what you have. So you don't need to do that work for you. that's on me. I can sift through the weeds of multiple different diagnoses and make sure that we get to the right answer. Whereas if you're looking things up online, you might find the right answer, but you also might find a lot of wrong answers, a lot of misinformation, and a lot of unnecessary worry.
You borrow a lot of worry, that's for sure. We use the term a lot now, the new normal, which is kind of the result of the pandemic, is what's going to be the new normal. So the new normal for us, for our relationship with our doctor now, for what do you think are the kind of the hallmarks? Should we ever have to go in for a prescription refill again? Should that just be a thing of the past? Is that part of the new normal?
Yeah, prescription refills is its own kind of funny thing, because some doctors will charge you for a prescription refill. Some doctors will do it automatically without asking you. Some want to see you in person every single time. So there's a huge amount of variation. But you're right that a lot of types of appointments that I see in primary care don't necessarily have to be in person. So some things you can't get away with having to do in person. I can't listen to your heart over the phone. I can't look in your ear over the phone. I can try looking in your throat on camera, but it doesn't always work out well. But some things can definitely be on camera. If I'm checking in with you about mental health, if we are talking about how a medication's working for you and if you're having any side effects, some of these things absolutely can be done on this virtual environment and then stepped up to in person if needed. So I'm finding a lot of it is very doable if we make sure that we are conscious of whether or not it can be done in person.
I have to kind of believe that also if we look at the whole healthcare journey, often when we have a condition, the very first step is you take a look at me, we have a quick chat, and then you send me for blood work. And then I might have to see you physically after that. But even just being able to get that blood, that assignment to the lab, so you know exactly what blood work to be done, to just kind of fast track. So we're not 2 weeks till you can look at me to talk about it, but we're only maybe 3 or 4 days because I can go and get that done right away. So those little assignments as well, I think, has to be part of the new normal, just a lot more
That's
convenient.
Right. I find that I'm sending off requisitions for a patient to get an ultrasound or blood work done or an x-ray. Instead of having someone come in, talking about it, and then giving them the requisition, they go get it done, come back. I'm emailing these things off to patients, and they can just get it done at a place near them that they go to, and then meet up with me after that. So they are saving themselves multiple visits, potentially multiple days off of work, travel times, going to a clinic more than once. They can get this done on their own and then come back to me, and we can have an appointment where we have all of the information we need. So it can be a lot more efficient, not only for me, but for the patient too.
But one of the things that frustrates me is all of the silos of information that I have now that I can theoretically have access to, but understanding where all of the information is. For example, I know I can go into Life Labs, which is one of our providers here that does the blood work, and get all of my own blood results done. And I can import that into the Apple kit so that I can actually see it there. But that's one application that I have to do. Another one for your provincial medical health records. You can gain access to all of these things, but there's no consensus as far as the place that the raw data lives. What do you recommend that patients like literally go through the energy and keep all of those accounts and try and gather that information themselves?
I definitely have some patients that really make a point of keeping all of their medical records digitally or in a binder. They like to have everything, because if you go to a lot of specialists and you see a lot of different people, sure, that can get really complicated. But having a family doctor, part of my role is to be that central source of information and to make sure that I'm getting all of these results from all the different specialists, all the blood work you've had done, all the x-rays. It's not easy, but that's the goal of my practice, is that I can be that central hub of information. I can make sure that this specialist is communicating with this specialist. I can make sure that you as a patient know what the bigger picture is, what all of these separate tests do. So you can definitely do that on your own, and it might involve a lot of phone calls to a lot of different labs, But that also is a responsibility that you can put on me, and let your doctor do that work for you if you're comfortable with that.
If we're lucky enough to have a family doctor.
That's a whole other story. Absolutely.
My thanks to Allie for spending some of her weekend and filling us in on all those topics. And you might have noticed, and you might have gotten introduced to Farley's sister-in-paw. That's Scandy, the Bernedoodle, who is the apple of both my son and Allie's eye. I will share in the shared note the Instagram account for Scandy, which is Easy Peasy Scandy Squeezy. That's the name of the Instagram account, but lots of cute pictures of Bernedoodles if you're into that sort of thing. So let's continue on and kind of get into a little more detail on our exploration of what's happening in the space of e-health. And, you will find lots of good online services that can help you doing things like checking your symptoms, etc., which Allie and I spoke about. And I'm sharing a few of those, one from the Mayo Clinic in the symptoms checkers, that because I know we're going to do that. There's no question that, we are going to check our symptoms. WebMD certainly is one great resource, but things like the Mayo Clinic have some really nice treed symptoms checkers that can walk you through the entire process so that you can ask the right questions of yourself before you, when it's 10 o'clock at night and you're worried that, as Allie says, you sprained your ankle and it turns into heart disease or cancer very quickly as you start going through the different process. But now let's talk about what I think is one of the biggest things as far as e-health goes, and that's the advent of the smartwatch and the wearables. These wearable devices are real game changers as far as I'm concerned. And when I first got my Apple Watch, I thought it was going to be primarily a fitness tool. And indeed, they are great for fitness, for tracking your steps and your calories, for encouraging you to work out more often and keeping track of all of that. All of the different trackers, be it Fitbit or the Google ones or the Apple one, they all do a terrific job. And I love the gamification of how the watch makes it that much more accessible. Just makes it exercise that much more accessible to us because we feel like doing it, because we're being reminded and we're being rewarded just by the fact that our watch is tracking it for us and giving us credit, as it were, for the exercise that we're doing. So I am a big fan. And if you look around you now, you just see so many more people with smartwatches on. It's almost become ubiquitous in a lot of cases. It used to be you noticed somebody that wore an Apple Watch, but now it's just part of the background, is it not? So the Apple Watch itself is part of Apple's Health Kit, which when we look at the fitness side of it, but then we can look at the health side, and the Apple Watch increasingly is adding different features that relate to health. Now, it's behind its Android counterparts in some areas, but it's ahead of it in other areas. So right out of the gate, most of the Apple Watches and most of the watches now will monitor your heartbeat, and they will detect an irregular heartbeat, and quite often they will let you know if you have an irregular heartbeat. And that's a great start. That's just a terrific place to start. But now we're starting to see the watches have built-in things like Ekg Monitors, which is a 2-point EKG, where you basically start the EKG going on your watch. With your other hand, you put your hand on the digital crown, which creates the circuit you want, and it does an EKG. Now, is it the same quality as you get going into a clinic where they put 20 pads on you? No, it's not going to give you quite the same information and feedback, but it is an indicator, and it's something that you can do for peace of mind and also to share the information with your physician should you choose to. So there we're starting to see the watch move into that space. I noticed with great excitement that Apple's latest version of the watch not only has the EKG monitor, but also it has a blood oxygen sensor, which is an indicator of how fit you are. So there's a fitness application by seeing how well you're oxygenating your blood as you're exercising. So that gives you a really precise idea of your level of fitness, which people that are working out, that's going to be great information. But that same feature of measuring your blood, the oxygen in your blood, is a terrific tool for as a sleep aid. Understanding if you have sleep apnea, if you're getting enough oxygen in at night, so you're sleeping with a healthy, comfortable, relaxed sleep. When you take a sleep apnea test, if you go to a clinic or if you do the ones at home, they will give you a blood oxygen sensor. I don't know how they work because it clips onto your finger. It's not like invading your finger. It's not like a needle going in or anything like that. But they put a clip on your finger and it measures your oxygen overnight, and then the doctor will tell you whether or not you have sleep apnea. That's one of the ways that they tell you, and then whether mitigation is needed. Well, the watch is going to do the same thing. Now, I'm a little bit concerned from one aspect. One side of me says this is an amazing piece of information, but this watch needs charging on a regular basis as well. So I always stick mine on the nightstand on the charger every night. I have a routine where it goes on the nightstand for the charger. So I wonder about using it for monitoring things at night, being as a wearable. But I guess that, these are really first world problems when we are talking about that. Now, if you happen to be an Android user, you're probably thinking that we spend an awful lot of time just talking about Apple's watch, and we don't spend as much time on the Android side. I don't know a lot about the Android watches because obviously I'm an Apple user, but all the research that I can find indicates that Samsung is doing a great job of competing directly with Apple with the Samsung watches, which fits into their ecosystem, and it looks like it's on a pretty even footing. I'm going to include a couple of reviews here where people compare the Apple and the Samsung watch. So I think it's well worth looking at if you don't want to be in the Apple ecosystem, but you are fascinated by the idea of smartwatches. If you are a Samsung user using the Samsung smartphone, then I think the Samsung watch is going to really appeal to you. For the rest of the world, Google also has the Google Fit watches. Now, like everything else in this space, it's kind of a pale imitation, in my opinion. Now, I can certainly be corrected by people that might know more than me about this, but in reading through all of the literature I can find on it and looking at the options you have, Google has basically licensed this technology out to a myriad of different watch makers. So you can buy Google Fit capabilities on watches that are made by Citizen and Timex and all of the other companies. They make these Google Fit watches, which will connect by Bluetooth to your smartphone. They will connect to the Apple ecosystem as well if you happen to want to have it connecting to your Apple kit, but it's not going to do as much as your Apple Watch. It'll do things like track your steps and your exercise and those sorts of things, but it's definitely not going to get into the details of things like the blood alcohol, the blood alcohol, where my mind is, the oxygen level. Now, the one area from all of the research that I've done where the Samsung watch is fairly significantly better than the Apple Watch is they have the ability to monitor your blood pressure. Now, I wonder about this. I'd love to test it out, because I don't know of any way of monitoring your blood pressure except like a traditional blood pressure putting on the cuff, which I will show you in just a moment. I've got a wearable system that I will demonstrate to you. But apparently Samsung is there, and we think Apple is trying to get there, but we will have to see. So let's stay now on this topic of blood pressure, because this is one of the things that we can do at home and monitor our health, that we can send to the doctor, I think is better than the old way. In the old way, you used to go in to see the doctor and they would take your blood pressure while you're there at the doctor. You've been running around, they would get a little tiny snapshot of what your blood pressure is, and they would try to treat you based on that. Or they would put you through a regimen where you had to go and you had to wear a blood pressure monitor for a period of time and go through quite an involved process where it's actually tracking you over several days, and for them to get a really accurate snapshot of where your blood pressure is. And then a lot of people kind of split the middle. They would get their blood pressure done at the doctor's office, and then they'd go to the drugstore or a local clinic, and they have these automatic blood pressure machines. But it's in public. You're sitting there, usually in the prescription area, sticking your arm in. Then while people are walking by, you're getting your blood pressure done. And again, you're shopping and you're probably a little bit stressed. I don't know what that does to your blood pressure, but it never seemed to me to be a very appealing process. Enter the wearables, where we can now put one of these on at home. We can test it very easily. We don't have to learn the skill of listening for blood pressure and listening for your heartbeat and pumping it up and then reading everything. But instead, it's a fully automated process, and these things work like a hot damn. Have a look. So this is the unit that I bought. We'll have a link to this in the description. It's called the Cardio, Qardio. And there are a couple of different models. There's some ones that look a lot more like normal blood pressure cuffs with the tube and all of that sort of stuff. But this one was nice and compact. I think it was a little over $100. Basically, you just kind of put it on your arm, and then you fire up the app. The app integrates really easily with the unit. You hit start, and then you just sit back and relax. They want you to kind of sit with your feet flat. This is not the best time for me to be taking my blood pressure as I'm talking to you, but you can see that it measures it. I can feel it pumping air in. It feels just like you're getting your blood pressure taken at the doctor. After a few moments, it releases and gives you the report. It is so convenient. You can do this anywhere. And the thing, one nice thing about it is you can also do it sitting at the same location, kind of at the same time of day, because it's so convenient, which is something that my doctor thinks would be awesome. Now, let's take a look at the history. Once you've recorded your blood pressure, it stores an entire history of all of your different measurements, and it will connect with Apple's Health Kit, and it will share the data with other apps that you give it permission to that might be interested in your blood pressure, such as Apple's Health app, which gives you a snapshot of your overall health, including exercise and weight, etc. But here's the thing that I like, is from Apple's Health Kit, there's no easy way for us to transmit that information to our doctor. However, right within the app here itself, if I go into the sharing button, I can take this my history here, and I can share it with to my doctor. I can put my doctor's name, his email address, or her email address, add any notes, and then I can send this data to them so that they can then look at all of my blood pressure readings and be able to make appropriate treatment recommendations based on that. This information is incredibly valuable to us personally, but it's so much more valuable when we can get it into the right hands, and getting it into the right hands easily should always be our goal. So that is a quick snapshot of the Cardio app, and the Cardio app and hardware, which I think is just a great solution. There are a lot of different manufacturers that make these Bluetooth blood pressure monitors. So we'll have some links in our shared note for some of them, but you can obviously just search and look in your local marketplace for others. There are other wearables that we have out there that are increasingly popular. We're starting to see people with rings. There's one called Aura Ring, which is, it does a subset of kind of what the Apple Watch does. It connects with the Apple Kit, it connects with the Google Kit, but it'll do things like measure your steps and measure your heartbeat and your temperature. And I think that they're getting into the space of doing the blood oxygen level as well, but it's all on a ring that you wear, which is a lot less invasive than the watch, and is also good for you to wear if you're in wet weather, if you're swimming and that sort of stuff. Although the Apple Watch is fairly water resistant, it gives you some additional options. I'm not sure where those will go, but they're an interesting option. Of course, the one that most people are interested in, or one of the places that the wearables have made the biggest difference in people's lives on a really tangible level, are the diabetes monitors, and even diabetes pumps that people can get kind of almost off the shelf now. But certainly the diabetes monitors, such as the Dexcom one, which we will link to. Now, I don't have any experience with those personally, but I've talked to quite a few people who have them. They seem to be a fairly expensive option. It looks like it costs about $300 for a month, because the patch, what happens is there's a Bluetooth patch that goes on your arm or goes somewhere on your body, and it samples your glucose levels and reports it to your phone. So it's constantly monitoring, which gives you a lot more control over your blood sugars. Having said that, the patches seem to last for about 10 days, and then you have to switch them out. So one package of 3 of them, they sell them in packages, is about $300. So it's about $100 per 10 days, or $10 a day is what it costs to utilize this, which is fairly expensive. Now, I imagine some health plans cover the cost, but it is an expensive tool, but it gives real convenience, and it gives a lot of control to people who are diabetic. And I know that they love the concept. Along with the blood pressure monitor, the other most popular tool that we find in the home are the Bluetooth scales and the connected scales. And I, again, have a link to this one of these. I've got one upstairs, and I use it on an ongoing basis. It constantly disappoints me with what it reports back as far as my weight goes. But there's no hiding from it. It's easy to do. You step on it in the morning. You don't even have to look at it right in the morning. You don't have to start off your day by looking at it. It'll send the information to your phone, and you can look at it when you're a little more prepared to look at that information. But it also measures your body fat. It does a body fat it shows you your percentage of body fat. Not too sure how accurate it is, but it does, again, give you another metric that you can work towards improving your physical health through. So these Bluetooth scales, and they've really come down in price as far as, and they're quite affordable now. Finally, let's talk a little bit about the connected apps that are there. Now, there's certainly in both of these ecosystems, there are a variety of different apps that connect for food, for exercise, for sleep. They'll track your water intake. Now, what these do, the important thing to recognize here is Apple has this health kit, which we access. If you're in the Apple world, you access it through Apple Health. And there you'll find screens that will allow you to share information and connect this app to other apps so that the information can transfer back and forth. It does a very good job of sharing information back and forth with the apps. As I mentioned with the conversation with Ali, and as I showed you when I was showing you the blood pressure monitor, that the Apple tool itself doesn't do a great job of sharing information with your healthcare provider unless they have an app that connects to the Apple Health Kit. Just getting information and just say exporting a spreadsheet with your blood pressure, it doesn't do that. You have to do that from the native app coming through. But we find all of these apps coming together, and we have control ourselves on our phone of what information gets shared back and forth. And this is something that I think we have to educate ourselves on if we're going to be using these health apps, because the privacy considerations are profound, which is one of the reasons Apple locks it down so tight, is they want to make sure that we're really paying attention to privacy in this equation. And so it's really beholden to us to educate ourselves on the process. And to help with that, we've got in this shared note, which we'll be sending you, we've got a great website that talks about Apple's vision of healthcare, so you can understand where they sit and what they're doing with it, as well as description of Apple's health kit, and a variety of other links, including the future of wearables, different oxygen sensor monitors, wearable EKGs, and a complete guide to Apple Health, as well as I mentioned, a link to Scandi the Bernadoodles Instagram page in case you happen to watch Scandi, which is, I think, good for your blood pressure. There's a lot of different aspects to this. I'm really curious about how you are using online health, what your thoughts are about connecting with your doctor online or using these tools to monitor your health. And I'm curious to see how many of you are actually using it. So let's move this over into the chat. There we go. Well, that was fun. Once again, the chat is so interesting as people have so much more experience in a lot of the different areas. You got to turn on your camera, April, as well. But there we go. That's it over. What do you think?
I thought it was good. I was reading in the chat, so I obsess over having my Apple Watch charged at night. Like I need it. Yeah. So I have it during the day, but sometimes when I'm sitting at my desk is when I stick it on the charger, because I like to know my sleeping, because I don't sleep that well.
Oh, so I like wear it at night.
I wear it at night. Yeah.
So. That's something that as I said, first world problems, just trying to figure out when your Apple Watch will be charged, because they last, it'll probably last about 18 hours, but yeah, definitely, I like to have it charged all day long. But I think that's one of the really valuable things. If you pay attention to your sleep habits, if you actually pay attention, you can really improve your overall physical health just by paying close attention to sleep.
You're so right. And I actually always look at my resting heartbeat, which is but like Kevin thinks that's so odd, but like it tells me how in shape I am. Because when it's lower, it's better.
Yeah.
So I don't
know.
Anyway.
Andrew's got it. The Apple loves you, Andrew.
Yes.
two Apple Watches and switch back and forth between them. You have a sleep Apple Watch and a waking Apple Watch. That's actually not a bad idea. That's pretty
Somebody
cool.
asked if they should wait for the new version of the Apple Watch, because I actually am on a very old version and I want to upgrade mine.
Well, they have an announcement later this month. I didn't hear that there was a new watch. The 6, I'm not sure how long ago the 6 came out, but the 6 has the blood oxygen and the 6 has the EKG. And that's the current one. And the prices stayed pretty flat on them. They haven't gone up a lot in price. Apple charges you an arm and a leg and another leg for the stupid bands. You'll pay more for a watch band than you will for the computer that's on your wrist if you're not careful. So you have to be a little bit, you have to watch that. Apple's watch bands are just like it's larceny. It's a form of larceny. Let's do this. Let's fill everybody in on some details and let's get to questions. And I apologize in advance if I don't have great answers for your questions, because I'm not obviously a doctor, although I play one in this webinar apparently. But there's, the thing is about a lot of these health things is unless you are in the need, if you have diabetes, you know a lot about these diabetes apps. If you know these, and I thank again people who are commenting who have experience using a lot of the different services. And making sure that you find the linkages and the connections. I think that's just such an important aspect.
That was interesting. I didn't realize about the ring. That was interesting. I actually had never heard of that.
We had a couple of people asking about the ring before we even showed it, saying that they wear one and they use it. And some regular members of the community were saying it. So it'll be interesting to hear back from them. The charge on the ring lasts for 7 days, they say. So that's pretty. That's pretty good. It'd be hard to remember though. 7 days is a long time to remember to take it off and put it back on. I wonder if people are going to start using it as a wedding ring. And now I'm going to track you for all time. And
true.
As a wedding ring. As I said, let's just do a couple of the details. Of course, we are brought to you through the generosity of our patrons. If you find the content that we deliver valuable and you want to be a part of our community and support us and encourage us to continue delivering these webinars on a weekly basis, then I encourage you to drop by patreon.com/Dottotech and take a look at what patronage involves. At $10 a month, you get access to all of our Webinar Wednesday replays, as well as 50% off on a lot of our courses, and of course, our eternal gratitude. We also have a $20 a month perk level, which includes access to our brand new series, which is Foundational Fridays. Every Friday, we are teaching basic level foundational principles of online marketing. This isn't for the advanced people that already know and have their mail list in place and are just funnel maestros. This is for people that want to understand the basic underlying principles of building an online business. We find that there's a lot of advanced information and we talk over people's heads a lot. We wanted to make sure people all work from the same baseline. So Foundational Fridays were born to support that. And every week we charge $10 per webinar. We deliver a brand new course on a brand new lesson on Foundational Fridays. But our patrons at the $20 level get access to all of those, as well as all of the Webinar Wednesday replays. So that is the best bang for your buck. And we appreciate the support incredibly. Also, quick shout out to our partners, our streaming partners, which is Restream.io. We are coming to you on both Facebook and YouTube because we have the ability to stream to multiple platforms using Restream. So if you are interested in live streaming and reaching an audience the way that we do here on Dottotech, then you're going to want to check out Restream. It is the tool that will get you there. All right, let's go to questions.
Okay.
Before I do though, coming up next week, nothing. I'm taking a week off. Steve needs a break. So Steve is taking a week off. We haven't taken a break since January, since we came back with our first webinar after New Year's. And normally we, have the odd little break for me to catch my breath because these things take a lot of work for me to put together. I need a break this week. So we're going to take a break this week. And then the following week, it's kind of an exciting one. We're going to start to be talking about a brand new course that we're delivering for content creators on using Patreon. So it's going to be a smaller subset of people that are going to be interested in Webinar Wednesday in 2 weeks. But the people who are interested, they're going to be some kind of serious interested as we talk about what it takes to build a community on Patreon. All right. So let's go to the questions.
Okay. There wasn't a whole heck of a lot, but there was, because
there was lots of great comments, I thought.
There was great comments. So David was asking about privacy when you were talking about telehealth and appointments.
And that's such a difficult topic to really talk intelligently about, because it's jurisdictional. So there's so many different jurisdictions that have different rules as far as privacy goes. In Canada, we have one set of rules. In the States, they have another set. That's one of the reasons that Apple has the health kit locked down so tightly, that because of dealing with privacy issues. In a lot of ways, that's why we have to be the holder of our own health information. We have to take responsibility for knowing where the records are and how to access the records so that we have access to them, because we can't rely on that information flowing naturally from one place to the other. As Ali said, if you do a call, on a telemedicine call, on just like an app-based call, and you get a doctor that could be anywhere, almost anywhere in the world, they don't know your history. And there's no instant piece of permission you can give them that allow them to go onto the computer and pull your medical history. It'd be amazing from a healthcare perspective if you could, but it would be terrifying from a personal privacy perspective if it was that easy to gain access to those most intimate of your records. So we have to hold them. So you have to find a way to have them available and to be educated enough on what's going on to be able to share the relevant information with your doctor during that call. And that's where, I remember back when the internet started, my doctor said, "Steve," this was an older doctor that's now since retired, "this internet is killing me. People come in with all sorts of problems that they find for themselves, and they print off sheets for me to look at."
That's me.
And they don't. And he was a curmudgeon, and it drove him freaking nuts. And so when we started this webinar, I had the bias that I don't think doctors want us to look at things ourselves, but I think that has changed now. And certainly talking to Ali, I got the impression that if we educate ourselves a little bit in advance, it's not that we're trying to diagnose ourselves. I don't think doctors want us to do that. But having relevant information that might be mitigating as far as what our condition is, that is incredibly valuable, because we are the only person that can give that to the doctor. So a lot of that responsibility falls on us. Fortunately, it's easy to find, but then also being organized enough to keep it one place, to have access to it when you're on that call. That's another crucial part. So,
well, one of the things when the pandemic happened, and here in the States in particular, and I know this only from experience of working with a healthcare provider, the softwares that these, their EMS systems that they're using were already we have HIPAA compliancy here in the States. And what they did was they quickly figured out, they actually had, so the one healthcare provider, they had this option to do telehealth before, but they never did it in concerns of privacy or whatever. But when the pandemic happened, they went and they did whatever they needed to the software to upgrade it. And of course, their costs went up. So they're paying more for the security. And literally, when a client logs in, it's a special secure interface, but the doctor does have access to their medical records if they've been a patient before. If they're a new patient, no. And then the way here, like we have Hartford Healthcare is our main hospital chain here. Same thing. As soon as the pandemic happened, they kept pushing you to go online, register your account. And so now your account's associated. And when we scheduled a telehealth appointment, the doctor literally could see your records and your blood and all of that stuff and kind of in their portal.
One of our regulars, Lawrence, is saying that he is actually working on a pharmacy prescription app. So stay tuned. So I'll look forward to that. Like, I wonder if, with your prescriptions, do they all have barcodes? Yeah, they've all got barcodes on your prescription. And so,
yeah, I guess they do, huh?
So I wonder, I didn't go into it just sparked my imagination right now. I want to do a little bit of research to wonder if there's an app that you can scan in all of your barcodes so that you can keep a database of the prescriptions of the drugs that you're taking that make it easier. Because I always just think, I think everybody's used to having that baggie full of prescription drugs that you bring to the doctor, like especially with your mom or your dad. If you're taking them, you always bring a bag of all of their medicine in. But that seems so. So
here, though, we have different pharmacies, so I'm not sure we could do that, right? Like, do you have?
I'm sure the barcodes would be standardized. I'm sure that the medicine would be standardized in the barcodes.
Could be. Yeah.
I would imagine so. I would hope so. Well, so it's good research. This whole thing is a learning process for us. We don't have all of the answers. There was
Chris
one
was
question
asking.
Go ahead.
I do have some questions here. So, how hard is it for a doctor to make an appointment and make an app for health information? So creating an app's a lot of work, depending on what.
The companies that have apps are the large healthcare providers that have massive infrastructure that because not only are they going to have to comply with all of the government HIPAA standards, but they're also going to have to get through Apple or Samsung's app stores and gain a level of trust to be able to have API integration into those apps. So there's a lot of hurdles that you jump through. I don't think the average doctor can do it. I wouldn't be surprised to see a service come up that smaller clinics can sign on to, much like the health club apps that do our reservation systems. But as Ali didn't seem to hold out too much hope for that. I'm a little bit more hopeful that something like that could come down the pipe. But that's something that we're just going to have to pay attention to. Steve comes from old school. Steve's got an old school comment. Very few doctors like us telling them anything. Trust me. I think that might be something which is slowly moving out of the mainstream as far as doctors. I think that they recognize now I think if you have a regular physician who you go to all the time, who has all of your records, they might have an issue. But certainly for these telemedicine things, I think we have to take responsibility. And even if they don't appreciate it, it's your health, right? It's your health. There was a question.
Sorry.
Yeah, the Geeks on Twitter says we need all of the health records being in blockchain. Well, that's certainly a way to protect them. That's for sure. Somebody was asking about if I could speak to the Fitbit because it's a lot more affordable than the Apple Watch. And yes, and Fitbit's got so many different models. The Fitbit was the first one that I had. And yeah, I mean, they were originally just like really a step counter, weren't they, at the very beginning? But yes, they are a more affordable option than the Apple Watch, and a lot of people like, and it will integrate right with the Apple apps. You know, you have to do your research to know what you're giving up. And I think, here's a quick, kind of a ninja buying tip. If you don't need the most current Apple Watch, when you go to apple.com or apple.ca, scroll right down to the bottom of the page and click on refurbished. Apple sells brand new watches, brand new iPads, brand new Macs that are considered refurbished. They might have gone out to press, been tested by press or anything, something like that. But as far as every time I've ever bought one, it looks brand new when it comes in. And so with the Apple Watches, depending on inventory, but when new watches come out, there's always some of the old watches in inventory, and you can save $50, $80, $100, $120 on the watches. There's more limited sizes, more limited colors than if you bought it from the store, but you can save a few bucks if that's what you're interested in. So just as a way
people were also mentioning, I know you were talking about the pricey bands, but they were talking about Amazon. You can get them as low as $24 for a different band.
Yeah, the bands on Amazon are super cheap. They aren't as, I mean, the like the Manila Loop, or is it called Manila Loop?
You're just spoiled. You're just spoiled because you're going to say they're not as good quality, aren't you?
I standardized on one Apple Watch band. I've tried a lot of the sports bands and that, and Apple's new fabric sports band, like when you're working out and stuff, it's the nicest. It's the one that I like. It's not the best looking, but it's the most comfortable. That's my experience.
All righty. We are at the top of the hour almost here, believe it or not. That went by quick.
All right. See, Kat Jude says they bought one of the Apple Watch refurbished. It's great, and it looks like new. Yeah, and you saved a few dollars, I'm sure.
Very nice.
Jude, for Canadians, Jude says that. Oh, no, I missed that. I just clicked on the wrong one. Let me find it here. There it is. Shoppers Drug Mart, which is one of the drugstore chains here in Canada. They have an My Pharmacy. I'll have to check that out. They're the people that gave me my COVID shot with Shoppers Drug Mart. I have a little Band-Aid that says Shoppers Drug Mart on my arm right here. It's kind of sore still. All right, folks, I hope that you found this valuable. I really, and once again, thanks for everybody that shared, so liberally shared their information here in the chat. Take a week off. go enjoy yourselves next week. Maybe you can watch one of the old replays. Those of you that are our patrons, you can pick your favorite webinar Wednesday replay if you need your daily dose or weekly dose of Steve and April. But if not, we'll be back in 2 weeks. Don't forget, Foundational Friday coming up this week is April teaching us about, help me out here. I know it's list building. And next week, Steve, that's me, is going to be teaching Foundational Fridays, and my topic, it's a good one. It's online payment systems. I'm going to go through the entire, give you a picture of all of the ways.
Mine's a good one too, by the way.
Yours is good, but mine's better.
Okay.
But they're both good. All right, folks. Till next week, 2 weeks, unless you come out on Friday. Till then, have fun storming the castle.
Have a great day.
By the way, thanks to Allie, if she's still listening. It was a great job. She did a great interview.
Thank you. Yes, that was great.
Yeah, follow Scandy on Instagram.
I was like, say hello to Scandy. So cute.
Cutest Labradoodle, cutest Bernedoodle on the planet. There we go. Till next time.
Bye, guys.